Comprehensive definition of dysthymia: persistent mild depression. Dysthymia, also known scientifically as Persistent Depressive Disorder, PDD, is a subtype of depression characterized by a chronic low mood and persistent lack of interest or pleasure, but with a lower intensity compared to Major Depressive Disorder, MDD. This disorder typically persists for at least 2 years in adults and 1 year in adolescents, occurring on most days and for most of the day. Individuals with dysthymia may struggle with a depressed mood, low energy, anhedonia, loss of pleasure, low self-esteem, and feelings of inadequacy from their teenage years or early adulthood. While these individuals are usually able to continue their daily activities, their quality of life is significantly reduced, and they may experience mental fatigue, poor work performance, and unhealthy interpersonal relationships. Comprehensive analysis of dysthymia, based on 20 specialized indicators. To achieve a deeper and more accurate understanding of dysthymia, this section analyzes it based on 20 specialized indicators that illuminate the various dimensions of this psychological condition. 1. Severity of symptoms. Symptoms of dysthymia are typically mild to moderate. However, what makes this disorder significant is the long duration of these symptoms, which over time imposes a considerable psychological burden on the individual and steadily reduces their quality of life. 2. Duration of symptoms. Dysthymia is recognized as a chronic and persistent disorder. According to formal diagnostic criteria, symptoms must persist for at least 2 years in adults and 1 year in adolescents for a definitive diagnosis of this disorder to be considered. 3. Temporal pattern of occurrence. The pattern of symptom occurrence in dysthymia is constant and persistent. Although the individual may experience brief periods of relative improvement, the low mood and lack of interest or pleasure generally remain present in their life without interruption. 4. Nature of psychological symptoms. Psychological symptoms of dysthymia include feelings of persistent sadness, chronic lack of interest or pleasure, lack of motivation to engage in activities, and feelings of hopelessness regarding the future. While suicidal thoughts are less common compared to major depressive disorder, their occurrence is not entirely ruled out and should be given attention. 5. Accompanying physical symptoms. Individuals with dysthymia may experience various physical symptoms, including feelings of chronic fatigue and low energy, disturbances in sleep patterns, such as insomnia or hypersomnia, decreased or increased appetite, and also periodic headaches or gastrointestinal problems. 6. Age of onset. Dysthymia typically begins at a younger age, during adolescence or early adulthood. Because its onset is gradual and the symptoms are less intense, the individual and those around them may for years consider it a part of the person's personality and not seek treatment. 7. Underlying physical conditions. The prevalence of dysthymia is more common in individuals who struggle with chronic illnesses such as chronic muscle pain, chronic fatigue syndrome, or thyroid disorders. It seems that the presence of these physical conditions can increase an individual's vulnerability to mood disorders. 8. Presence or absence of psychotic symptoms. A distinguishing feature of dysthymia is the absence of psychotic symptoms. In this disorder, symptoms such as hallucinations, unreal sensory experiences, or delusions, false and irrational beliefs, are not observed. 9. Mood swings. In dysthymia, severe mood swings, which are a primary characteristic of bipolar disorder, are usually absent. The mood of an individual with dysthymia remains relatively stable at a low level. 10. Response to pharmacological and psychotherapeutic treatments. Treatment for dysthymia typically requires a comprehensive approach that includes a combination of low-dose antidepressant medications and long-term psychotherapy. Therapeutic approaches such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, can be effective in managing symptoms and improving the quality of life for these individuals. 11. Influence of environmental stimuli. Stressful life events and psychological pressures in the life of an individual with dysthymia may lead to an increase in the intensity of existing symptoms or cause a relapse of symptoms after a period of relative improvement. 12. Behavioral characteristics. Common behavioral characteristics in dysthymia include social withdrawal and reduced desire to participate in various activities, decreased motivation and energy to perform tasks, and reduced work or academic productivity. 13. Cognitive changes. Individuals with dysthymia often experience reduced concentration and attention, chronic feelings of worthlessness and self-criticism, persistent negative thinking about themselves, others, and the future, and a decreased level of self-confidence. 14. Specific symptoms. One of the specific symptoms of dysthymia is the lack of experiencing deep joy or positive excitement, even in seemingly pleasant situations. Some of these individuals describe a chronic feeling of emptiness inside. 15. Presence or absence of motor symptoms. In dysthymia, significant motor symptoms are absent. Characteristics such as complete immobility, catatonia, or stupor are related to a more severe type of depression called catatonic depression. 16. Influence of genetic and familial factors. A family history of depression or other mood disorders is recognized as a significant risk factor in the development of dysthymia. 17. Emotional state after onset of illness. Dysthymia is usually a chronic condition with periods of relative improvement. Without appropriate treatment, the likelihood of symptom recurrence in these individuals is very high. 18. Symptoms concurrent with other mental disorders. Dysthymia is often seen concurrently with other mental disorders, including generalized anxiety disorder, obsessive-compulsive disorder, or personality disorders, especially avoidant or dependent personality disorder. 19. Patient socioeconomic status. Typically, individuals with limited social relationships, stressful jobs, or who experience low social support are at a higher risk of developing dysthymia. 20. Manner of onset and reporting of symptoms. It is noteworthy that many individuals with dysthymia consider their chronic feeling of depression to be a normal state and therefore do not report it. In some cases, physical complaints such as fatigue or headache may be presented as the individual's main concern. Join the Mental Today of anxiety, strategies for improving mood, modern and effective psychological treatments, and the intricate journey of self-discovery. We sincerely invite you to join our warm and dynamic community on the Mental Today educational channel and benefit from our valuable and informative content.